tutor in Stephen College of Nursing, take immense pleasure to welcome you all with this beautiful morning. We have organized this webinar as we have received a very good feedback from the previous webinar, which was successfully organized by Stephen College of Nursing. So we would like to promote this knowledge to the next level. That's why we have decided to come up with this second series of webinar. The theme for today's webinar is Healthcare Delivery System in India. This program will be continued for next 2 hours, that is from 10 a.m. to 12 p.m. I feel honored to have with us our esteemed principal ma'am, Mrs. Munidhar, and our admirable administrative sir, Mr. Manoj Kotru from Stephen College of Nursing. I thank them for providing their gracious presence to join us today. And also I pleased to welcome our speakers, Dr. Mehmooda Regu, Principal and Professor from Alamdar College of Nursing, International University for Science and Technology, and Mr. Vazhumuni Sir, Assistant Professor from Stephen College of Nursing, faculty, and my dear students. The essence of education is to help you discover your uniqueness, teach you how to develop it, and show you how to give it. These words by Leo Buscaglia. With these lines, I would like to inspire speakers and listeners to participate in the webinar. I now request our beloved principal ma'am, Mrs. Munidhar, to address this gathering and giving her valuable inputs to all the participants. Over to you, ma'am.
Okay, thank you, Nancy, ma'am. First of all, I'd like to say good morning to one and all. I would like to congratulate the staff and students of Stephen College of Nursing for the grand success of our inaugural webinar. I would also like to take this opportunity to thank management for continuing with these webinar series. As we all know, healthcare delivery system includes the aggregate of institutions, organizations who has responsibility to promote the health, prevent illness, detect and treat the disease, and carry out rehabilitation. That is to facilitate and improve physical, mental, or cognitive abilities of affected clients, which they may have lost because of disease or stress or injury or as a side effect from any medical treatment. As we all know, that main objective of this healthcare delivery system is to enable all citizens to receive healthcare services at their doorstep as and when needed. These services should be cost-effective and based on pre-established standards of quality. Dear participants, health system and policies have a critical role in determining the manner in which health services are delivered, utilized, and it also affects the health outcomes. India has mixed healthcare system inclusive of public and private healthcare service providers. The COVID-19 pandemic has thrown open challenges on multiple fronts, such as reconfiguration of care in hospitals and at community health setup. In response to COVID-19, that has led to many patients suffering non-COVID conditions having to delay treatments. And at the same time, the lockdown, which though necessary, has affected people unequally, and some being much worse off than others. The pandemic does not seem to be leaving in a hurry, so we should utilize the time and resources to strengthen healthcare delivery system. As a nurse, this is our responsibility. We have to accelerate the learning and skill from collaborating with private sector. We should adopt digital technology, social media, and also adopt efficient ways of working to emerge pragmatic, resilient, and more stronger. So, to throw more light On the topic today, we have with us my dear friend and colleague, Professor Dr. Mehmooda Ji, Principal Alamdar College of Nursing, Srinagar, J&K, and our own Mr. Vazhumuni, Assistant Professor, Community Health of Nursing, both of whom have spared their precious time out of their busy schedules to interact with our students and participants and share their knowledge and experience with them. So I would like to declare this webinar open by inviting dear Mehmooda ji, Florence Nightingale awardee and pioneer in the field of nursing education and research, to take over and grace this occasion. Thank you.
Thank you, ma'am, for such an impressive speech. Before stepping into the webinar, there are few instructions to keep the quality of sound functional during meeting. Please mute yourself. I request participants not to share their screen. Only speakers will share the screen while presenting. If you have any queries during presentation, please type them into the chat box. I'll bring them up after the presentation has ended. If you are facing any kind of technical issues to connect this meeting, then you can join us live on YouTube. Thank you. Now I turn time over to the presenter. The first presenter of the day is Mr. Vazhumuni sir, Assistant Professor from Stephen College of Nursing. He has done his Masters in Community Health Nursing from Nursing College, Pondicherry. So, sir will be presenting on the topic Healthcare Delivery System in India. Now the time is over to you, sir. Sir, please unmute yourself. Vazhumuni sir, please unmute yourself.
Yes, ma'am. Am I audible, ma'am?
Yes, sir, you are audible.
Thank you very much, Nancy ma'am, for giving brief introduction about myself. Honorable Nursing Administrator and Advisor, Manoj sir, beloved Principal ma'am of our college, Mrs. Munidar ma'am, and beloved Principal of IUST, Institute of Technology, Professor Dr. Mehmooda ma'am, respected teachers, and dear students, good morning to one and all, and I welcome all on the special occasion that our college conducting the second webinar on the topic of healthcare system. So myself, Vazhumuni, all know that Assistant Professor of Stephen College of Nursing, that I'm going to give a lecture on healthcare system in India. Okay, let's start our session. So I want to share one story regarding, apart from this healthcare system, I want to share one thing. That is, just 90 years before, so if you want to need any technology based materials, if you need any healthcare materials, we have to buy from other countries, right? So it should come by traveling through ships or through roads or through aeroplanes, right? So just 90 years before, most of the transportation only by means of what that is through ships only. So if you want, if in India, if we want to buy any materials, we have to get nearly it will take we will get everything from England. For example, England, we will get all the technology. So it will come through the ship. So nearly it will cross the Atlantic Ocean. So Atlantic Oceans and near the Arabian Sea. So then it will enter into our country. So nearly it will take 18,000 kilometer. Okay, 18,000 kilometer to reach our country from England to our country. Nearly 18,000 kilometer. So if we are receiving this technology in late manner, definitely there is lacking of we have to spend more money on this, and also quality. If we need quality, definitely it is lacking. Because of this long distance, we have to spend more money on this. So at the time, so the world, they have planned that. So they have to make one small bridge to reach from England to India. They have to make a small bridge for the sea. That you all know uh, that is Suez Canal, right? So that is built between the Egypt and Israel. Between the Egypt and Israel, they have made the Suez Canal just 90 years before. So that I told na, from England to India, it will come around the Atlantic Ocean through the Arabian Sea, then it enter into the India. But in this Suez Canal, it will reach from throughout the that Suez in the Egypt and between the Egypt and Israel, then it will reach shortly to our country. So, but it will take only 11,000 kilometer. Nearly 9,000 kilometer is saved due to this thing. Then if you are reaching these all technology priorly, definitely we can minimize our cost, then we can get quality as soon as possible, right? This is the concept.
Excuse. Sorry to interrupt you, sir, but please reshare your screen.
My share is not visible. My slide is not visible, ma'am.
No, sir.
My voice is audible.
Yes.
My slide is visible,
Yes,
ma'am.
sir. Now it is visible.
Yeah. Yes. That is quality, and it to reach the people as soon as possible is essential. So for that only we have made that delivery, that is healthcare delivery system. Same relation we are focusing in healthcare delivery system also. So in that healthcare delivery system, so especially my students know that is post basic students. Post basic students are there, yes. So when I'm entering the class, I will ask two questions in a consistently daily manner. I will ask two or three questions, right? One is, what is the backbone of community health nursing, right? And second thing is, define epidemiology and define community health nursing. These three questions I will ask in a consistent and daily manner, that my students knows this, right? So the backbone of community health nursing is home visit, that you all know that. So same relation. So quality of health. What is the backbone of quality of health? That is nothing but healthcare delivery system. Understand? Healthcare delivery system is the backbone of quality of care. So that for that only we are going to discuss elaborate and overview of this healthcare delivery system. So this is the framework or synopsis of my content. Okay. So I'm going to share details about, I'm going to give some concept about healthcare delivery system, because already all know about the healthcare delivery system in detail. I'm going to give just share about the concept. So what's the overview of healthcare system in India that is present at present? Then public health. because healthcare delivery system, we are delivering the health services to the public. It is not an individual basis, we are giving as a population base, that is public, in order to reach all. Next, that public health, for giving the health services to the public, how we have to approach, that we must know. Then only we can give, then only we can give the health services to all. Okay, then how we can approach the public health. Then, so what are all the healthcare evolution at present, what are all the still, what are all the healthcare evolution in India after the healthcare delivery system implemented, what are the evolution taken place in India, that we are going to discuss. Then, that you all know, that is organizational structure at the union level, at that is central level and state level. Okay, then major innovations and reforms in India. So that I told now, if you are built a bridge, then build a bridge between the Egypt and Israel, then we reach our technology as soon as possible. So after implementing this healthcare delivery system, many innovations, and we can build many innovations and reforms in futures, okay, for the benefit of people. So that also we are going to discuss. Yes, this is the overview of healthcare delivery system. So we are delivering the healthcare under the three subdivisions. One is public sector, another one is voluntary health organization, the third is private, that is a private sector. Okay, so for public sector, you all know that is two things that we all know about, the two things, that is urban and rural. Okay, then the third, autonomous and NHP, that is National Health Programs, and Ayush, that is Ayurveda, Yoga, Unani, Siddha, and Homeopathy. Clear? So what are all the institute, what are all the hospitals comes under this urban? For example, I am telling that ESI hospital, railway hospitals. Okay, so yes, ESI or railway hospitals are comes under this urban. Autonomous institute, we all know about autonomous. For example, JIPMER, that is present in Pondicherry. It is central government, but it is one of the autonomous institute of our country. Then AIMS, which is present moreover all the states. That is even in Jammu, they are going to build new AIMS. That is also one of the autonomous, under the central government only. Then national health programs. You see, so national health programs. So NACO, you all know about the NACO, National AIDS Control Organization, and tuberculosis, that is tuberculosis, district tuberculosis center, everything. These all things comes under this national health programs. You see, when you are entering into the hospital, any primary center or community health center hospital, there will be a medical officer, right? So that medical officer plays dual role. Mainly that PHC, CHC comes under the rural, but that medical officer also in charge of some National AIDS Control Organization, district tuberculosis center. So that he or she plays two roles. Clear? So one is rural, another one is national health program. That is separate. This is separate. If you are conducting 8-day program, so you will comes under the in charge of NACO officer. If you are conducting any general program in sub center, he or she will comes under the medical officer of concerned community health center. Okay. Then finally Ayush, that is the separate institute, various institute and hospitals present in the all over the states. That is indigenous system of alternative medicines. Then second is voluntary health organizations, that is in national and international level. Yes, national and international level. So one of the example we can say, that is Red Cross Society, that is present in Jammu, and in international level, that is WHO, UNICEF, etc. Okay. Then third, that is private hospitals. So hospital itself two things. One is super specialty, district hospital, everything present in private also, as like public. And one more thing, that is trust hospital. For example, one of the trust hospital present in Jammu also. You know that the name of that hospital, I think Sri Mata Vaishnavi Devi. Yes, that is the trust, one of the trust and private institutions. Okay. Then second is consultation. That is a consultation clinics. clinics, that is special clinics, clinic center, wellness, health and wellness centers conducted by a separate physician or medical officers. So this is the overview of this healthcare delivery system which is present in India. The common concept of this setup to reach the to give the effective healthcare to each and every people, both urban, suburban, and rural people. For covering these all peoples only, they have made this system, healthcare delivery system. Understand? Okay, next. So that I told, sir, what is the concept of public health, sir? So you told, so main concept of public health in India, if disease condition is avoided, the probability or the chance of death or disability can be reduced. Yes, are you agree with this? Yes, definitely. That is, if you are not getting any disease condition, definitely we will not go for any disability. Definitely we will not go for any chance of death. So if you are just avoiding any type of disease is a coming but non-communicable, definitely we will not go for any alteration of any death or disability. That is the first concept in India. Then second is public health deals with group of people rather than individuals. For example, in community health nursing, that I told that backbone of community health nursing is that home visit. So home visiting, we are visiting the home on an individual basis, right? Individual basis. But here if you are if you are going in individual basis, we can't cover all the people. Definitely, is it not right? So that if we are otherwise we are gathering all people in one particular area, definitely we can give effective care. For that purpose only, they have developed various institute or center. Even we can take this COVID time. So from March to till we are waiting for vaccination. Still they are developing the vaccinations. Okay, you after developing the vaccine, even we can face difficult for putting the vaccine to all people. Definitely it will one of the great challenge of our country, because we are having more population, right? So that is comes under public health deals with for people rather than individuals. If you are giving vaccination in the home basis, is it possible to cover all the people? No, definitely not possible. So only they are giving through the health centers like sub centers, community health centers. So people gather all these centers, then we can cover moreover, not 100 percentage within a limit time, but we can cover moreover 90 percentage of people. Well, so for that only it will deal only with the group of people. Okay, so what is the purpose of making the vaccine? In order to avoiding the disease, I won't get any COVID. For that I have to vaccinate it. Okay, for that purpose only they are making the vaccine. That is, not only the vaccine should be in quality manner. Okay, even some of the country, the Sputnik, various vaccines are coming, but yet to be finalized, yet to be validated, because that should be given to all people. It should not make any side effects, right? For that purpose, quality is one of the important, that for avoiding the disease condition. This is the concept. You can correlate with COVID with public health concept. One is that is developing the vaccine for taking more time in order to giving a quality of health. Okay, it is a group of people rather than individuals. In order to, if you are going individual based, definitely we can't cover all people. Okay, for that purpose only we have to make a delivery system, then only we can cover all the people. Here, yes, this is the concept of public health. Okay, next, sir, how we can approach the public health, sir?
Excuse me, sir.
How we can approach?
Sir, please resuming share screen. It is a request from participants.
Okay, ma'am.
Also, I request participants not to share their screen. Only speaker will share their screen while presenting.
Yeah, is it visible? Thanks, ma'am.
Yes, it is visible, sir. It is visible.
Yeah. So last slide we discuss about the concept. What is the concept of public health in India? So next approach. Okay, sir. Now vaccine is ready. Vaccine is ready, and health center is also ready. How we are going to approach? How we have to approach, sir, for giving this vaccine? How we have to approach for developing one vaccine to the all people, to each and every people, both urban and rural people. So there is two things. I'm dividing in two things. One common concept, that is traditional. Another one is modern. Okay, traditional you can take a 19th century. Okay, so at the time they have done to avoid. If I want to avoid disease, death, and disability, they have focused on personal hygiene and public sanitation. Okay, so now I want to avoid COVID-19. Definitely, I need vaccine, right? But at the time, I want to avoid diseases. I'm telling just example. Okay, you take as an example. During 19th century, I want to avoid a disease or disability. They have focused personal hygiene and public sanitation. Okay, for giving the health education, they have given only these two things. They have given more our health education. They are focused specifically on these two things: personal hygiene and public sanitation. They gather all the people on community health, community setup, community halls. They have given the personal hygiene. You have to maintain personal life. To sanitation. Then only you can avoid diseases, disability, everything. Okay, this is one of traditional approach of public health, that is to the people. Yeah, then that is related to that I told. So reaching the vaccine to all, that is related to this. Next, that I told, a vaccination, Sputnik vaccination for preventing the diseases. That is here Ayurveda. At the time, they have focused mainly Ayurveda. So not only in India, all over the world, they prefer the Ayurveda medicines. They prefer the Ayurveda treatment. Whatever disease, whatever things happens, they will go for the Ayurveda. Then automatic they will approach Ayurveda. Only you go if you are getting anything, go to the Ayurveda. Go to the Ayurveda, taking Ayurveda medicines. That I want to share one thing also. So at this time, we are taking COVID, at this COVID scenario, we are taking both allopathy and also homeopathy. So we should be careful on this. Definitely, if you are taking both drugs in simultaneously, definitely there will be a lot of side effects. Recently, one of my street friend, she died. Actually, she is 3 months pregnant. She get aborted the hospital. After getting aborted, before that she has taken only allopathy medicine. But after getting aborted, she has taken some of the relatives recommended the Ayurveda, that is allopathic, some of the homeopathy medicines. So she went for the homeopathy medicine, that is Ayurveda. She has taken that medicines whatever doctor prescribed after the abortions. Okay, so within 2 to 3 weeks, actually she died. Actually, she died because doctor also said that is because of that they have taken the both drugs in simultaneously. So we should be careful on this while going for Ayurveda medicines. Okay, but in traditional approach they have focused Ayurveda, one of the things. Next, okay, and I hope everyone understood about this traditional approach. That is, we can take before independence. This is traditional approach. We have approached the topic. Then now, that is modern approach. That my students knows that epidemiology. They all know about the definition of epidemiology, right? So epidemiology, that is measurement of disease condition in relation to population at risk. So what is the modern approach? What is the epidemiology, sir? That is that once a lot of diseases are coming nowadays, right? So we need a manpower to measuring the disease conditions that is present in all over the population, all over the area. How many how many diseases, what is the severity, what stages. So everything they are measuring in order to controlling that diseases in future, that is population at risk. For example, disaster. If one disaster tsunami occurred in seaside area, na, definitely how many people are affected. Okay, how many people are affected with this tsunami? Male, how many? Female, how many? And children's. What is the cause? What is the effect? Everything we have to collect. Then only we can prevent the thing in future. Definitely by giving the health education. Okay, so this climate, especially during this January and December, you more prone to get the tsunami. Be careful. Be always be precautionary. Okay, for that purpose, they have one of the this is one way of approaching, that is epidemiology. Clear? Then statistics. Okay, after measuring the how many persons that you are displaying the vital statistics, right? That is what is the mortality rate, what is the morbidity rate, what is the infant mortality, everything government released their official website in order to getting the fund for health services in order to develop the human development index. Okay, that is for that purpose they are making everything in written format. For example, one of vital civil registration system for registering the birth, death, divorce, marriage, everything they are registering on this only. That is epidemiology. That is this one way of modern approach for public health. Okay, then health services that I told na, traditional approach they make the Ayurveda, but now services directed towards meeting the health, meeting the needs of people. That is service directed towards meeting health needs of people. Whatever people. So if I'm taking the allopathy medicine, I'll be good. If I'm taking homeopathy medicine, I'll be good. So I'll prefer on this. I'm going to prefer on this. So based on that, government providing the funds, government providing the services. So that is the they are approaching on this only. So you are having this condition, you are having this is the complication side effects. Which type of treatment you want to prefer? Okay, it's up to you. So recently, the National Health Policy to 2017 also they have launched better allopathy. They have to better coordination with Ayush services, alternative medicine. We have definitely we have to people can go for prefer of Ayurveda medicine also. So it's up to based on needs of people they are directing the health services. This is the modern approach. I hope everyone understood about these approaches, the traditional, modern. Traditional, that is if we want to avoid the diseases, they are focused specifically hygiene and sanitation in traditional manner, but in modern approach they are focused epidemiology. They are measuring the disease, then they are release the statistics, what is the mortality, morbidity. Based on that they are avoiding we can avoid the disease in future. Next, the second is they have prefer Ayurveda in older system of medicine. They have prefer Ayurveda, but nowadays based on their need, based on their willing, they can go for any treatment, whether allopathy or Ayurveda. Clear? Yes. Next. Okay. Healthcare evolution in India. So healthcare evolution in India. So evolution of public healthcare system in independent India shaped by two important factors. That I have made these two important factors based on my point of view. I have made these two important factors. But lot of when starting the healthcare delivery system, lot of things are coming. Then only our delivery system has enlarged and enshrined everything. But based on my view, I have made these two important factors. Right. That is. First thing is report of first health survey and developmental committee, board committee. Okay, sir. That is, I know now we all know about the public health concept. Avoiding the disease, it's not individual, it's group. Okay, you all know how we can approach the people also. Now you know. Okay, so we can't implement after knowing the concept and approach. We can't implement it. Definitely, we need a recommendation from expert. Then only government can implement this in at present. Okay, at present or in a consistent manner. So they need some recommendations. Not only if you're asking, sir, only we need a recommendation of any experts. it is okay for giving the healthcare delivery system in an effective, in a quality manner? No. There is an emergence of the second emergence of modern medical technology for prevention and control of disease, especially communicable diseases. I will explain this each and everything. Clear? Next. Yes, that I told. That is two important factors shaped our evolution. So even not only board committee, after that Mudaliyar, Mukherjee, Jungalwala, various committee, but this is the stepping stone of molding the healthcare delivery system. Okay, so Sir Joseph Poor, Dr. Sir Joseph Poor was this committee is the in charge of that committee, appointed in 1943. So after they have taken, he has taken nearly 2 or 3 years for doing this research. That is, so now we know about the health concept. Government decided, sir, we know about the health concept. So we know about how to approach, but we need a clear evidence. So because larger population are there, what's the we don't know about what is the ratio of nurse patient ratio, doctor patient ratio, doctor nurse ratio. So give some report regarding this. So then Sir Joseph Bohr, after 2 years, he has given the recommendations. So based after doing the study in all over the state, I have given the recommendation, that is interpretation of preventive and curative health services at all levels. So he has noted that only they have made the preventive healthcare services. Moreover, the state cover only the preventive healthcare services. That is, before getting the disease, what all the things, health education, they have given this type of services in all over the area. So we have to interpret both preventive and curative service, because not only the prevention, but also people are affected. Some of the people are affected with condition also. For that, we have to give effective care. So we need an interpretation of both preventive and curative health services at all levels, sir. That is the not only here some of the only the district level, not in rural level, only urban level. So these services definitely we need at all levels. That is the first recommendation given by this board committee. Then second is hospital-based healthcare systems. Okay, so that I told. So we should not prefer, for example, house to house visit, home to home visit. Okay, on common schools, health community halls. We should prefer on like this. We have to construct on hospitals. We have to construct some health centers, government health centers. Then we have to gather all surrounding people to that particular center. Then we have to give the health that I told now. We have to construct on hospitals. Then only we can cover all the people. So Sir Joseph Bohr also told that we should construct a hospital for giving the health services at all levels. That is the second recommendation. For that only that developed the PHC, the primary health center. He only recommended the first thing, that is primary health center. There is a need of primary health center, especially in rural people, because once government are launched various schemes, various services, it is not reaching at rural area because of not awareness, because of lot of population, rural population. When compared urban, rural having more population. So definitely we have to develop on hospitals, own centers, that is PHC, yes, sub-center and community health centers. Clear. Then finally, training in preventive and social medicine. After putting these stepping stone by Sir Joseph Bohr, now lot of medical students, lot of nursing students are going there. What a training during the study. At the time of studying, we are going there. What the meaning? That is a training. We are going the training when we are studying. At the time, we are going training, right? So that is a stepping stone done by this Sir Joseph Bohr. Okay, these all the recommendation, important recommendation. That is a stepping stone of delivering the healthcare services. So, training in preventive health medicine. They need social medicine. After finishing the MBBS course, definitely the concerned medical officer have to train 3 months, minimum 3 months, for getting experience, for getting deal with the rural people. So that is one of the example for this preventive and social medicine. So recommendation of board committee. Then that I told, the second important factor, that is molding the healthcare evolution, that is molding the, that is enshrine the healthcare development, that is emergence of modern medical technology. So early development of use of statistics for analyzing data obtained in medical practice occurred in the 19th century, and slow evolution of public health and preventive medicine began. That is that we are using the statistics, that I told now, statistics, that is started early, that is in 19th century, but getting enshrined during the time of modern technology only. So later on only, after implementing the statistics, after registering, government released the mortality morbidity rate, then only there is a evolution of public health and preventive medicine began. Yeah, there is the importance of public health and preventive. Apart from that hospital, there is a need of public health and preventive medicine. They came to know about that. So they have launched various medical technology. For example, so just before the, we can divide it two part. One is before COVID, after COVID, definitely. So that before COVID, we didn't see about the various advanced technology venti machines came in our country. Who are all working in hospital sector, they came to know about these venti machines and rapid test, testing the COVID test. So these all are comes under the modern medical technology. Emergence of this medical technology and staying in the country in a consistent manner. Okay, this is the recommendation given by own country. But if any sudden crisis, for example, COVID is a pandemic, that pandemic just 5 to 6 months before, at the time many modern technology has came, like venti machines, very advanced venti machines, that rapid test for testing the COVID, everything came. But it will not go after COVID get over. It will not go, it will be stay, because once one disease came means definitely there is a possible of recurrence again. So they won't give up this modern technique. So they came and staying in country. Likewise, the healthcare delivery system getting emerged. Clear? So mainly these two important factors molding this healthcare delivery system. Clear? Next. Organization structure. That organization structure at two level. One is central, another in central government, Union Ministry of Health and Family Welfare, Cabinet Minister, that is head of ministers, central ministers. Then for assistant of Cabinet Minister, there is a Minister of State is there. Then under the assistant of Minister of State, there is a Deputy Health Minister. This is the departments of concerned in charge. That is Department of Medical and Public Health, Department of Family Welfare, Department of, that I told, indigenous system of medical and homeopathy. Yeah. So these are all the three departments. So they are the in charge of these three departments. Under these departments, certain members are working. That is secretary, joint secretary, deputy secretary, administrative staff. I think this slide is not visible to all, so please adjust it. So because I download it from official website, it's showing like this only. Just please just with this. I'm just explaining. Clear? So Department of Medical and Public Health, Secretary to Government of India. Under this, various joint secretaries, mainly secretaries or IAS officers. Yeah. Then deputy secretaries and administrative staff, that is B grade staffs. Clear? Next, Department of Family Welfare. Department of Family Welfare, same like that. Public Health, that is secretary, additional secretary, joint secretary, Commissioner of Family Welfare. Okay. Next, administrative staff. Departments of, as like Ayurveda and Siddha, Secretary to Government of India and Assistant Secretary, Joint Secretary and administrative staff. They are all manpower who are in charge of the healthcare delivery system. This is the organization pattern at central level. Okay. Next. This is at state level. For example, I have taken one example of this is the setup of Rajasthan. Rajasthan, one of the state of our country. So this is the their setup of Rajasthan. That is government of Rajasthan. That divided into two things. One is Ministry of Health and Family Welfare, Ministry of Medical Education. They are giving the services as well as the research. So under this, there will be one Principal Secretary of Health and Family Welfare. under the Ministry of Health and Family, Principal Secretary. He'll be the one of the in charge of all the secretaries, Principal Secretary. Okay. Next, under the Health and Family Welfare, there will be the Secretary Medical and Health and Secretary for Family Welfare. That is, there is a separate secretary for medical health and separate secretary for family welfare. So under this various divisions, that is public health, that I told now, public health, then director of AIDS, there is a separate director of AIDS, separate director of IEC, that is information, education and communications, then separate director of that is Rajasthan, that is health sector developmental project. For example, if you are going Jammu, it will goes to the Jammu health sector developmental project. There is a separate director for developing the health of particular state. Separate, apart from this IEC AIDS, likewise concerned state related director will be appointed. Then director of reproductive and child health, RCH, then director of family welfare. Okay, under this additional joint deputy and zonal directors, as like that central level, same like that. That is, one is, first thing is additional joint deputy and zonal. Yeah, this is the organization setup at state level. Okay, next, that I told. Okay sir, that is we approach. Okay, finally, these are all the evaluations that I told, board committee and modern medical technology, the important factors for emerging this healthcare delivery system in our country. Then what are the innovations and reforms they have done after implementing this healthcare delivery system? So that is, we have made the Suez Canal. We should know, after making the bridge of Suez Canal, how some other country developed just before, because we have saved the 8,000 kilometers. So definitely we need expectance. We save a lot of money on this. So likewise, what are the innovation reforms after entering the healthcare delivery systems, or we can or in consistent manner. Okay, that is, first thing is national rural health missions, that you all know that national rural health missions. So it was recommended by this healthcare delivery system. Then Rashtriya Swasthya Bima Yojana, RSBY. This is the health insurance program led by Ministry of Labor and Employment, below poverty line, getting selected of set of tertiary care services. They have select only the below poverty line, who are under the below poverty line. Yeah, they will give the insurance. They will give the insurance for getting the tertiary care services. Okay, in order to cover that, I told now, reaching the healthcare services to all, that is also one of the important thing. Then quality. So reaching the healthcare services to all, for that purpose only they have made this RSBY, health insurance scheme, for selecting only below poverty line, giving the health insurance scheme. Okay, next, that you know, Pradhan Mantri Jan Arogya Yojana. Lot of schemes are there. Lot of schemes are implemented by central government, but these are one of the specific important schemes I have made. Okay, Pradhan Mantri Jan Arogya Yojana. That is coverage of tertiary care for vulnerable populations and health and wellness center initiative for the delivery of comprehensive and integrated primary care. That is, they are covering the tertiary care, that I told you, below poverty line. They have comes under the vulnerable populations. They have comes under the vulnerable population. In order to give the effective, they have made some of the health and wellness center for particularly for vulnerable population. We can take a rural population or hilly or tribal areas. So under in order to get effective and quality care, they have made this Pradhan Mantri Jan Arogya Yojana. Next, the next is initiating a provision of universal sanitation coverage and making the country open defecation free through Swachh Bharat mission. Yes, you all know that, right? Swachh Bharat mission. What is the important thing? That is sanitation. That I told na, one of the traditional approach, public sanitation. Now India also taken that approach in order to avoiding the diseases, that is sanitation coverage and making the country open defecations. Okay, every individuals have to construct latrines at their home itself. Government also giving lot of funds to needy people. Okay, that is below overall vulnerable population or below poverty line. Clear? These are all the major initiatives innovation and then launching the intensified mission Indradhanush 2.2 to achieve the 90% vaccination coverage for children under 2. So within 2 years, after getting 2 years, who are all know that, sir, I vaccinated my children, vaccinated all the vaccine under the after before entering after 3 years, or sorry. So at the age of 2 years, my child vaccinated all over the vaccine, whatever vaccine government, tuberculosis, measles, rubella, everything. But it's not, we can't say that is 100%, only 60 or 70%. For that, they have, in order to reaching that vaccination to all people, they have launched the intensified mission Indradhanush. That is 90% of vaccine coverage for children under 2. Everyone has to vaccinated under 2 years. That is the motto. They have make that destination, the 2025 have to cover 90%. Clear? Next, providing clean cooking fuel, that you know, clean cooking fuel under the Pradhan Mantri Ujjwala Yojana scheme, giving the fuel. Next. So these are all the innovations and reforms made by India after, through the healthcare delivery system. Yes. Okay. So you all know that, sir, you're going to comparing UK healthcare system with India. Take a positive. So even we are also getting frustrated if our parents compare with they have good marks, we have failed. They have taken good marks in it. We are not getting good marks. So parents are comparing. Then don't compare me with anyone. We have said even, but we are taking positive. For example, so after finishing higher studies, what I have to study? Shall I choose nursing? What is the scope on this? Some of the students not know about it, but we can give example. Our students. So we are the students. We have done the, after higher studies, we have done the BSc nursing. After completed the various hospitals are giving the open recruitment facilities. That is AIMS, PJMR, JIPMER, everything. Then we got selected. This is positive way. If you are comparing that person got the job in JIPMER. If you are comparing that person positive way, then okay, choose the nursing profession. So likewise, you take this as a positive way. We are comparing that UK, that I don't like England. Even one of the vaccine is ready. That is in Oxford. You know that soon is going to come in India. So only I'm comparing various countries, developed countries, that I'm comparing that UK healthcare system in India. Small review of this. That is, you all know that capital of India is New Delhi. United Kingdom, the capital is London. National language for our country is Hindi as well as English. Then UK, that is British English. This is the map of India, UK, that you all know that, right? So I'm giving the overview. So total populations 1.384 billion in India, 64.5 million in UK. So fertility rate, that is each and everyone giving the birth a particular thing, that is 2.13 children per 1,000 women. In India, 1.81 children per 1,000 women. Okay. Then life expectancy that is age is 68.37 for male, 71.46 female in India. Here male 79.2 and female 82.8 years. That is CDR, that is crude death rate. Okay, within a specific population, that 7 death happening per 1,000 population in India. In UK, 9 death per 1,000 population. And crude birth rate, birth during the specific population, 17 live birth per 1,000 population. Think 17 live birth. Here 12.2 live birth per 1,000 population. That we are giving more live births. Okay. Next, under 5 mortality, that is 34.3. Under 5 mortality, that is morbidity, disease rate, mortality, death rate. So per 1,000 live birth, 34.3 death happening. Here 1,000 only 4.2, because of we are having more population on this. Clear? Next, gross developmental product, GDP for health, that is 3.53 and 9.63. So this determines how we are spending the cost, how we are spending the budget for all over the health among, so not only health, various department in every countries, but we are spending 3.53 percentage, they are spending the 9.63 percentage. So still government have make this more on this expenditure of health in order to develop the GDP. Next, human development index, that we are having the, in order to developing from developing to developed countries, we should prevent the poor, that is below poverty line. For that, we are in rate of 0.647, that is we are in 129th rank in human developmental index. In UK 0.909, that is they are in 9th rank. Clear? Because of we are having the lot of populations, you can just compare this 1.384 and 64 point. Next, health problems of the country. These are all the common health problems between these two countries. That is most common cause for mortality. Just think that this is for general knowledge. Okay, for the purpose of general knowledge only, I'm just explaining, because healthcare delivery system is what's the healthcare delivery system in India, what's the healthcare system in other country. If we compare this, then we came to know that okay, our health system like this, we can remember this. For that purpose only I will make this. Okay, so most common cause for mortality, disease, COPD, diarrhea, stroke, and road injuries. For morbidity, disease, diabetes mellitus, hypertension, and cardiovascular diseases. In same like that, UK, most common cause for mortality is ischemic heart disease, cerebrovascular disease, malignant neoplasm, respiratory diseases. In morbidity, that same like this, coronary heart disease, diabetes mellitus, COPD, and cancer. Next, challenges. These are all the challenges for both UK and also India. They have too long waits for specialty and elective surgeries. Still, they are needing the more nurses. They are needing more healthcare professionals from other countries. They are waiting for the specialty. They are waiting for healthcare providers. You all know that. So every month, they are calling the UK is giving the open recruitment for abroad nurse. Okay, next, they are making the here absence of universal coverage. Now, India has launched the universal coverage for giving the comprehensive health services. So anyway, that is one of the challenges for our country. Universal coverage for all people, because poor population is there. Here, higher tax rate. Okay, their tax rate is higher. Then lower quality facilities, lack of medical resources, progress in medical technology cost the NHS, that is National Health Services. Here, uninsured people need to wait for routine care till their basic insurance. So who are all not insured, that is uninsured people who are having insurance. For example, if you want to do the cardiac surgery in operations, now, if you are having any insurance scheme, then only you can do the surgery free of cost. But most of people are uninsured. So for that, government has to initiate this insurance policy. Then it will reach the all people for free of cost. That is one of the big challenge of our country. High administrative cost. So for spending the for constructing the hospitals, everything they need, we have to spend more cost. Definitely, our country has spending more money on this infrastructure. For example, some of the AIMS and ESA hospital they are building, so they are spending more cost. Then disparities in access to health treatment. So this is also happens in this India. So this is one of the challenges, disparities. We should not go while accessing the treatments. The urban people are getting more, rural people not getting more. So this is one of the challenges. Yeah. Next, India is this UK healthcare system. Both are public sector. This is national tax-based financing. That is this is for India. I'm telling public sector and national tax-based financing. Patient responsiveness. Okay, we are private hospital is also there, but we are most depending on public sector only. Same like that UK also. We are depending on the national tax-based financing. Okay, next here private. They are having they're also in health sector, that is national health services there, but little bit the private risk-based financing also they are dependent. Then patient response. Not only the India, not only the UK, all countries are giving health, implement or developing health services based on the response of patient only. Yeah. Next, this is the structure. I made in a small scenario, that is organizational structure. This is the India, central level, state level, regional, district, then further divided into urban and rural areas. That you know that central, state, regional, that is district, and that sub district. Then it will go to the urban and suburban. This is the organization structure. Here, this is also federal is also same like that. Central, under this health service, public health, primary care. They have gone federal to urban and rural areas. They are having the primary care groups. Under this, they are focusing all peoples. Clear? This is the comparison. Next. So levels of healthcare. This is the important one. That is primary care in India, sub-center. That is, the 3,000 to 5,000 population. Primary health center, that is 20 to 30,000 populations. In UK, they are giving the primary care through the CHT, that is Community Hospital Trust and General Practitioner Clinic. We are giving through this PHC and sub-center, they are giving the Community Hospital Trust and General Practitioner Clinic. They are giving the primary care. Who are all the primary care givers in India? That is in rural level, ASHA, that is PHC, Village Health Guide, Anganwadi worker, ANM. This is for rural level. Urban level, the midwife and health workers. Okay. Here, they have given the primary care given general practitioner, nurse, community nursing staff is there. There are also district nurse for that making the district nurse. Then midwives and health visitors. Secondary care, this is primary care. Then secondary care, we have focused the CHC, that is community health center and district hospitals. They have made only the district general hospital specialist by using the specialist. Then tertiary care. So the regional and super specialty. Yes. College and hospital, specialty hospitals. Okay, medical college and hospital and specialty hospital, they are giving the regional and super specialty hospital. Regional means that is district level. Okay, both district here, secondary and tertiary, they are maintaining the good, but added some super specialty hospital. We are giving here medical college and hospitals, both attachment of college and hospital, and we are also considering the super specialty hospital. Even in this one super specialty hospital is also there under government. Yes. Right. So this is about overview of healthcare system. So, and that's it about the healthcare delivery system. So if you're having any doubt, you can ask me. Nancy ma'am?
Yes, sir. Thank you, sir. So there are some queries, but if time permits, we will continue with the question from you, sir, in the end.
Okay.
Thank you, sir, for your excellent presentation.
Okay, sure, ma'am.
So moving on.
Thank you, ma'am.
So moving on, I would like to introduce second presenter of the day, Dr. Mehmooda Regu, Principal and Professor, Alamdar College of Nursing, International University for Science and Technology. She has done her Masters in Community Health Nursing from Rajkumari Ambedkar College of Nursing, New Delhi, and her doctorate from Indira Gandhi National Open University, New Delhi. Ma'am will be presenting on the topic Healthcare Delivery System in India. Over to you, ma'am.
Thank you. Honorable management of Stephens. I'll say I'll congratulate the first speaker. You have almost covered everything. And it was an excellent presentation. I would address honorable management of the Stephens College of Nursing, respected principal and faculty of the college, dear organizers, participants, and students and the speakers. Good morning to all. I'm really humbled and on webinar with very useful themes. That's healthcare delivery system in India, because this is the base of the community health nursing. If we'll go to the health, because the first speaker, he has almost completed each and everything of the healthcare delivery system in a very nice way. Then if you'll first go to the health, what is health? It's a if you'll go to WHO definition of health, it is only we are healthy when we are physically, mentally, socially healthy. That is, it is not only absence of the disease or absence of the weakness or the infirmity. And when we will be healthy, we will be a productive nation. We will be socioeconomically productive, and we can be present in schools as well as at our workplaces whenever we are healthy. Then what is not being healthy? Is it illness? Health and illness. One of the teachers, whenever she was opening the book of community health nursing, she was talking of the health wellness continuum. My first speaker, maybe he also must have heard it. It is health wellness continuum. When we'll go to the services, systems, we should know, because it's a continuum, it's a process. Sometimes we are in some stage of health wellness continuum. So illness, what is illness? When we need health care, illness, it's a state again in which a person, we as a person, we are physically, emotionally, intellectually, socially, or spiritually, some of the functions are impaired, diminished. We are not that as we were when we were healthy. So in the health wellness continuum, we need health care, we need assistance of somebody. So it is, what is this health care? It's group of services which we as community health nurses or a health system, we will render to whom? Individuals, families, and a community at large. And we are not only nurses, it's a team, health professional team. So different people from different cadres will be helping the people. So what help we will be providing to the people? It is, if it is disease is not there, we will be helping them in preventing the disease. That is most of the times our prime role. That is, we will be preventing the disease. Then second, we will be, because you know why I am talking all this, because my slides and it's all what our first speaker covered. So I am giving background of something else. Then about promoting health. Promoting health is again preventing diseases. Then we are apprising people how you can be healthy if there is no disease. So we are giving them knowledge and wisdom about promotion of the health, restoration of the health, and maintenance of the health. That is our role as community health or public health people. Then if we'll go to healthcare, it is everybody's. If we'll go to the Constitution of India or any other constitution, it is everybody's right, every citizen's right to be healthy. So if we go like that, it is the responsibility of the government to provide health care to the people or to the citizens of that particular country. Like that, as Indians, it is duty of the government to provide health care system to the people of India. So it is health care is delivered by the health systems. What is this health system? If we can define health system, so you can say it is whatever we have, it is organization of that. It is organization and distribution of all the resources of the society pertaining to the health. We have to allocate equally to the every citizen. That is, these services, it should not be more, most of the times, the services are most concentrated in the cities and less in the rural areas. So we have been, whenever we were talking, our teachers were talking, yes, it is, there is discrimination in the urban-rural distribution of the health services. And still we can see so many things are made, but it is not, we have not, even when we will think of the Boer Committee of 1944, we have not reached to that level. It is still a Bible for us. It is still a very high thing for us to reach to the level of Boer committees, all the recommendations. We have not still covered all the recommendations, but we are trying, our government, they are trying to give best to our citizens. So this healthcare delivery system, it is organized at local, state, and national levels. You can say it is designed to deliver services. It is those services which are essential to restore the health of the citizens. Why we give healthcare system? It is to improve and protect the people's health, meet the needs of the entire population, cover the full range of preventive, curative, and rehabilitative, what I said, equal distribution of health services, both in rural and urban areas. Then we are making change in healthcare delivery system based on the changing trends, because we know this. If we'll go to the changing trends, what there, if we'll see demography, it changes. It changed, because previously, if you go to few decades back, we were having less elderly. Now we have more elderly. So demographic trends are changing, social trends are changing, because we are sometimes, we are socioeconomically better than what we were previously. So our purchasing power is changing. So our political trends are changing. Maybe previously political organizations, they were busy in other parts of the development. Now they are more interested in giving healthcare to the people. So political trends, political interest is changing. Then technical trends are changing. Technical trends, you know what technical trends are? Technical trends is, previously we were not having specialty and subspecialties. Now we have more subspecialty, super specialty. Even we are using other sectors, that is genetics, genetic engineering. That is what we are talking, what my first speaker was talking of. This vaccination. Vaccines are not made by doctors. They are made by people, experts from genetics, people, experts from biochemistry, and so on, and so, immunology, so on and so forth. So we have vast technical trends. We have vast experts in healthcare scenario now. Then, if you'll see the demographic profile in India, because as usual, since we were born, everybody was talking India is a populous country, and see now still we are talking same. We have more population, large population. We have high fertility. Mortality is decreasing. Decrease, more elderly are there, then there is more young population, there is more unemployment, and because of that, dependency ratio is about 65.5%. So that also we have to keep when we are talking of the healthcare delivery system. We have to think of morbidity and mortality rates, and disease specific mortality and mortality rates also guide us, makes us wise about which system of healthcare we need, what way we have to help our people. We have to see the environmental conditions of our this places. We have seen so that is, we have seen environmental degradation and this emergence of new problems, emergence and re-emergence of new infections we have seen because of the ecological imbalance. Socioeconomic factors, which I say, when we are talking of, we are socioeconomically better, but when we will say we'll go to slums and suburban areas and we see their out scenario, we see how far away we are socioeconomically, we are not able to afford even to scare meals. So cultural background. So sometimes we were talking of this indigenous system of medicines. When we'll talk of indigenous system of medicine, cultural background. Some people say indigenous system means nothing. Some people say indigenous system of medicine, Ayurveda and all that, homeopathy and all that medicine, they are even doing that for this malignancies. So it is cultural background, which type of medicine they like. Then attitude, how much they are positive towards healthcare, their beliefs, their practices with health. Then medical and other services available. So it is availability of we are planning, government is planning, so many systems are there. We are planning so many things, but there is what is available actually matters. Other services available means if services are available and they are far away, we don't have communication, we don't know where the services are available, transportation is not available, then it means nothing to us. Then when we will talk, when we were young students, then we were talking of health problems in India. And that time also we were talking of communicable disease as the number one problem. If we will still see communicable disease is number one problem, because we could not control malaria as we should have. We could not control tuberculosis as we should have. And diarrheal diseases are there. And cholera is not there. But acute respiratory infections are there. Leprosy, filariasis, AIDS, Kala-Azar, meningitis, these eruptions are there. So communicable diseases are there. The nutritional problems, if you go, nutritional problems are still there despite having good healthcare system. Environmental problems still there, because we could, ecologically, we were talking of this agent, host and environment. And it is not that dirty drainage system, etc. is there, but polythene overuse made the environment worse than it was before. Then sanitation problems still there. Then medical health problems, medical care problems, means whatever we have, because of the population, because of overpopulation, things get diluted. We are there. We are not still able to reach to the expectations of the people and needs of the people. And population problem, as usual, it is there, but it has, people are now wiser than before, but people from lower rung, that is people from low socio-economic status, they are not able to have population control because they are not sure of survival of their children. They keep 5-6 children there because they cannot afford immunization, they cannot afford good nutrition, they cannot afford good development of the sanitation of the people, good development of the people. So they are not sure of the whether they will survive or not. Because of that, we cannot control population. So these are the, nowadays we are talking of the non-communicable diseases. As my first speaker, he has nicely dealt with the non-communicable disease problem, which are existing more in, if you'll see more, those diseases are existing more in the developed countries, but here also we don't have less those problems, but because those problems are equally in higher socioeconomic group as well as lower socioeconomic group. So it is health problems are there. Then what health care services we are giving? This also almost covered. I am just repeating: preventive services, promotive services, curative services, rehabilitative services. Then if you'll see what should you think of healthcare system, providing healthcare system to the people. Healthcare system, whatever we will be providing to the people, has to be comprehensive. Comprehensive means it has to include all the this preventive, promotive, rehabilitative, curative, everything. Then accessible means, as I said, if it is not communicated to them and transport is not available, we have to communicate to the people. We have to keep things available so that they can reach there. Then acceptable. Acceptable means, maybe I will tell some when they are vegetarian. So whatever I will be talking to the people, it should be acceptable to them as per their religion, as per their social, as per their culture and other factors. Then participation of the community. So that is there is one thing we should believe, that we have to put people's health in people's hands. That will, because we will be talking, we will be giving health to them through them. So when we will be giving health care to them through them, they will become sensitive, they will become wiser, and in our absence also they will be practicing same, and we will be saving so many resources. So it is resource, it is you can say it's a good thing, it is helpful to the people if we will make them to do their health care, or to involve, we will involve them in their health care. And Chinese proverb is, at the end of the day, they'll say, we did it. and they will feel better. They'll say, nobody did it, we did it. So, but they facilitated us. So we have to be facilitators in participation, community participation or people's participation. And whatever health services will be there, either health services has to be free. That is, one of our teachers, she was saying, if it is everything is given free, they don't value it. But it has to be affordable. It has to be affordable. We don't have to think of the people who are rich, who can afford and who have purchasing power. But we have to think of the people who cannot afford and those who are in more need of your health services. So we have to give health services which are affordable to the majority of the people. Then why should we give healthcare services? Again, my first speaker also, he has enlightened you with this. That is, you are decreasing the mortality and morbidity rates. You will be increasing the expectation of life, and you will be decreasing the growth rate, that is population growth rate. Then you will be helping the people in one or the another way, providing them, or they will be generating themselves nutritional status, improvement in nutritional status, because nutrition is base for being healthy. Then again, basic sanitation. I said whatever infections are emerging and re-emerging infections are there, they are because of the environment, food. They are the most frequent causes of diseases. Then we as health workers, we have to meet health manpower requirements. We have to show this we need. For this much of the, as this first speaker was talking of the ratios, we have to depict, we have to show this is the manpower we require. That is good healthcare system. Then we have to see the resources. We have to utilize maximum available resources, whatever resources you have. And you have to think of, you must have heard Man Ki Baat of Modi ji. Most of the times he talks of resources, he talks of food production. That is, we have to increase the food production. We have to make ourselves self-reliant. We have to make ourselves self-reliant. At least we should be able to produce our own area's food. Then increase literacy rate. That when people will be literate, they will be understanding how they can be healthy. So we have to raise the socioeconomic status of the people. That is, if poverty level will be they will be at the poverty level, below poverty level, they cannot think of their 2 square meals. Then they will not be having food. They cannot live. They will not be clean. They will not be having basic amenities. They will not be having shelter and clothing. They cannot be healthy. So this is our health system is only when they have the basic things. So then I heard my teacher, she was talking when they went during 1977, they went to the community and they were talking of Alma Ata. They were talking of Alma Ata Declaration and Health for All by 2000 AD. Then people wahan pe Delhi, colonies, no suburban colonies, they were going, ma'am, yahan pe ghar mein aata nahi, to Alma Ata kya karega? So that is what we have to focus. We have to focus on basic amenities, their nutritional status, their clothing, their shelter. Then only we can talk of higher and prevention of the other diseases. Then healthcare systems, jo hai, again I will say, my first speaker, he has dealt with, there are healthcare systems which are existing in our India, or public sector, private sector, indigenous systems of medicine, voluntary health agencies, and national health programs. These are, come afterwards. These are some of the ways by which we can provide healthcare system in India. Then public sector. Public sector kya hai? Public sector, it is the government sector. That is, we people, we are providing primary health care. Primary health care, that is, again, you as students, all of us as students, we have read it. Primary health care, it's a comprehensive health care which includes promotion of health, prevention of diseases, therapeutic care, and rehabilitative services. Primary health care movement, again, you all might have read it, that it started in 1977 in 30th World Health Assembly, WHO Health Assembly. And though when we were talking of health for all by 2080, and they thought of reaching the health for all by 2080 through primary health care. And this movement in India, government of India then they started launching national health policies, so that they have seen this, we will be reaching to the people through primary health care movement by national health policies. Again, you all know what is this primary health care, and you all must have read it. It is primary health care kya hai? It is an essential health care, and which you have to provide, you have to make it universally accessible to the individuals, families, and communities at large, and you have to make it acceptable to them. That is, as I said, acceptable means in every way, whether it is culture, whether it is their religion, whether it is their region, because sometimes you know our Kashmiri people don't take curds at night. They say it because during winter particularly, they say it will be colder. Otherwise, there is no issue in taking curds at night. So that is, it has to be acceptable to them when we will talking. And again, whatever we will be doing, we have to do it through full participation of the people. And also, whatever we have to do, we have to see whether they will be able to afford it at the cost that a country and the community can afford. This is what WHO has given this definition of primary health care. प्राइमरी हेल्थ केयर का आपने सुना होगा कि elements, 8 elements, all of us when we were asked to write in papers, and now you as students, we also as students, that is first thing in primary health care is what we all community health nurses are doing. We are educating people. Prevailing health, these are the prevailing health this problems of your area. As I said, demography is different in different places. We will be talking, this is the prevailing health problems of your area, and these are the methods of preventing and controlling these diseases, these health problems. Then this is the first element. Then second, you will be talking promotion of food supply and proper nutrition. As I said, health depends on what you eat. And sometimes people say, we are what we eat. We are made what we eat. So you should, again, I always, whenever I talk to my students, I am a student myself, whenever I think of being healthy, I think of food. I think of good nutrition. So you always, whenever you as community health nurses, you should have a very good knowledge of calorie intake. You should have a very good knowledge of what are the best foods for which disease, what are the foods to be restricted, what are the foods to be given, what are the sources of this different constituents of food. We all as community health nurses should know. Then adequate supply of safe water and basic sanitation. This is because when we are talking of other sectors, this is, we have to apprise the people, we have to talk to the people about safe water and basic sanitation. And MCH and family planning. MCH and family planning, it covers lot of population when we will be talking of maternal and child health and family planning. Then immunization. Again, every infectious disease can be prevented when we have vaccination, because nowadays we are talking of coronavirus. We are not able to move freely out of our homes because vaccines are not available. Even AIDS vaccine is not available because it is difficult to have vaccination for retrovirus. AIDS, it's a retrovirus. Like that, so people have different, and they say if vaccine will be available, it will not be having long lasting effect, it will not last for 1 year. So it is, they are trying to have, that is first thing what we have to talk to we have to sensitize the people to have this vaccination about the infectious diseases, and that starts right from the birth. You all know, you have read, and we are all studying and practicing it. Prevention and control of locally endemic diseases. I said, as per the demography and geography of the people, these areas, there are different diseases at different areas. So we have to sensitize people about prevention and control, and we have to work for prevention and control of locally endemic diseases. Then appropriate treatment of common diseases and injuries. So we all should know, and we all should practice this appropriate treatment for common diseases and injuries. And again, eighth element is essential drugs. Provision of and government should have this available essential drugs for everybody, so that we can in our healthcare system, we can make people safe by essential drugs. Then principles of primary health care also you might have read, that is equitable distribution, community participation, intersectoral approach, appropriate technology, and focus on prevention. I don't need to go in depth in that, because you all know that's equitable distribution. It is nothing but irrespective of irrespective of any bias, we should provide healthcare services to everybody. But first bias was rural urban, but there should be no bias, no geographical bias, no other bias in distribution of the healthcare services. As I said, people's participation, it is very important to have to involve people in their own health, so that they without you also they will be able to identify their needs. They will be able to assume the responsibility. They will be knowing the problems and needs, and they will be able to assume the responsibility and go to the healthcare, avail the available health services. I have seen so many studies people are doing on services are available, but services utilization of health services, so many people are studying nowadays, and still being services are available, healthcare systems are there, services are available, but people are not using. Why they are not using services, we have to find out. So equitable distribution is people have to they have to use, they have to have available, and community participation means they have to know and utilize the services. Then again, always we should focus on prevention. You know, you will be talking all the technologies. Then about appropriate technology, you know, my teacher example what she was doing when we were MSc nursing students. We used to have this milk in bottles. Nowadays it is in envelopes or some that is a milk supply. Then and when you go talk to the rural people, they will have that milk in lotas, in containers, in traditional containers. Though she was talking to us, when you are talking you showing urban things to rural areas, that is not appropriate. So you should, whatever they are practicing, you when you are making chart, you should make those images only, what they are familiar with. That is the appropriate technology. And appropriate technology is anything, whatever you will talk, it has to be acceptable to them. That is talking of appropriate technology. Then about intersectoral approach is, you cannot do healthcare only with health people. You need people from other sectors also who will be helping people to be healthy. Then about when you'll see primary health care in India, I talked as per the WHO Almata Declaration 1977. But when we will go to the India, we were previously also practicing primary health care in India. When our Srivastava committee in 1975, they have launched rural health scheme. All of you must have read that it is a healthcare based on principle of putting people's health in people's hands. You might have heard it. So it is, we were practicing it in 1975 only on the recommendations of the Srivastava committee. We were talking of putting, that is, people's participation was there. We were using village resources. We were using sarpanchs, their schools, then other places. so that we can have health melas, and we will be giving wisdom to the people about prevention of the disease. Then primary health care, as per this Shrivastava committee, they said it has to be at 3 levels, like village level, sub-center level, and primary health center level. Then village level, if you'll see, nothing new. Village level, when you'll see village health guide scheme. Village health guide scheme, it was introduced on 2nd October because Mahatma Gandhi's and Mr. Shastri's birthday, 1977, and it was almost introduced in all the states of the India. But they changed it somewhat in May 1986. That is, they said male health guide. It is better to have female health guides in the village. Then in our Kashmir also, that time we had Rehbar Sehat. Now we are not talking of Jammu and Kashmir had Rehbar Sehat scheme instead of village health guide scheme. And what they were, as per this, they were responsible for one village or 1,000 population. They were just in a particular community which they belonged to. They were taken as permanent residents of that place. And also, if they were knowing this A&Ms, or if they were knowing something about medicine or nursing, they were preferred. And only people, when they were not available, people who can read and write were preferred. And at least 6th standard people were, till 6th standard were, well-to-do people, well-educated people were available, they were preferred. Then people, they would be spending 2 to 3 hours daily in the community health activities. And also they have to be energetic, physically active, and willing to serve at least 3 hours as a community health worker. And they should be acceptable. Person who is a village health guide, they have to be pleasant and acceptable by all sections of the community. They should not belong to particular political organization, and so that they will not be accepted by the people. So these are the village health guides. Still they are there. Then a village health training, you might have heard of their training also. They were trained at either primary health centers or sub centers for 200 hours for 3 months, and they were provided with manual or kit for after completion of the training. And also as I said, they were their jurisdiction was for 1,000 population. Then you might have heard of and read about local dyes. Local dyes are very resourceful, because still people in far-flung areas, these local dyes are conducting this deliveries. So they have they thought of, in this only Shrivastava committee recommendations only, they thought of making these local dyes traditional birth attendants as trained birth attendants, skilled birth attendants. And then they thought of giving them formal training for 30 working days. And they were paid a stipend of 300 during their this training period. And also, again, this training was at PHC, sub-centers and MCH. And their training was their training still it is there. It is 2 working days per week. And also remaining 4 days, they will go to along with health worker female, multipurpose health worker female, to the community. Then again, most frequent practice, Anganwadi worker. All of you might be familiar with. Then if you see, it is long back, that is 1952, when we started Integrated Child Development Services Scheme. And each ICDS worker, again, they are for 1,000 population, and every one ICDS project is for 100 Anganwadi workers, or with one ICDS project, and one Anganwadi worker is responsible for 1,000 population. Now with this, the rural health mission and this health mission, we have introduced new people, that is Asha and Usha. Asha, accredited social health worker. She is for rural areas. Then there is Usha, that is urban social health activist. And both of they started under rural health mission. They started it Asha's this cadre in 2005. Then what is role of Asha? Asha, she is providing awareness to the people. But Asha, and yeah, she has to be middle aged, and she has to have this education up to 8th. I have seen people with PhD also working as Ashas. That is a second question. What Asha does, all of you are familiar with Asha's work also. Asha is providing health education. Should Asha provide health education, she needs lot of help from us to prepare her to provide health education, because it is very sensitive issue providing health education to the people. Only those people can educate about health, those who are familiar with each and every concept of health. They are talking of nutrition when they have no comprehensive knowledge of nutrition. They are talking of diseases and problems when they have. So we have to give them working knowledge so that they are able to educate the people about their health. Then they are dealing with MCH and family welfare, and they are mobilizing community participation. They are motivating people. That is, we have to train them how to motivate people. Then develop plan for healthy community. Then provision of primary health care, distribution of essential drugs, all those primary health scenario, all the primary health care elements they are doing, distribution of this essential drugs and ORS, the important and sensitive things they are doing. And they are participating in training programs, and they are registering births and deaths, and they are promoting this environmental sanitation. And because when we are seeing in periphery, everything, if you go to the rural health, everything in the periphery is done. That is, all the national health programs, they end in the implementation ends in the periphery. So we have to be available there. Yes, we can have assistance from Asha, but we have to be available there, and our role is better and greater than Asha's and Usha's. So, and then we as nurses, we have to be with the people. So that will be great thing. That will be best utilization of our what we know. Then about sub-center level also, when you'll be giving healthcare at the sub-center level, sub-center level, we do everything at sub-center. Immunization is done. Sub-center, sub-center kitne ke liye hai? Sub-center is, as your first speaker said, it is for 5,000 in plains and 3,000 in hilly and tribal areas. Then what we do at sub-center? Immunization, MCH care, family planning, health education, growth monitoring. We advise, we give health education on nutrition, and there's MTP services. Then adolescent healthcare means everything. Then we are monitoring water quality, safe water supply to the people, promoting sanitation, community need assessment, training of DAIs and ASHAs. We are doing immunization and vitamin distribution, iron and folic acid distribution, treatment of common ailments, diarrheas and acute respiratory infection. So whatever functions of health care system, that is actually everything is done at the sub-center level. And who does it? Who is there? There we have male and female multipurpose health workers. So they are very important people, and they feel they are, and they have, by Government of India, they have frequent orientation and reorientation programs, so that they will be up to date with whatever is available in this healthcare scenario, and they will be talking to the people about that. So, as I said about Boer Committee in 1946, that is why I call India ahead of all the countries in terms of planning health. care. But healthcare system, as I say, if we will go to volumes of Boer Committee in 1946, we have not achieved all the recommendations of the first committee of our healthcare system. So first thing what they talk is focus on comprehensive curative preventive health services in rural areas. They have given, because then it was 90% of the people were in rural then in 46, only 10% were cities. So when we will see, because they were more focused, they were saying it is then when it came, they were talking of 2080. Then it is, they said, if you will be catering to the rural areas, you will be catering to whole India. So still we have problems in rural and far-flung areas. So if you will see, voluntary health guides, they were focusing them more on the rural areas. That is 1,000 this one rural health guide for 1,000 population. Then sub center also, as I said, for rural areas. Then for primary health center, they said it is 30,000 KLA in plains, 30,000 KLA, one primary health center should be there, and 20,000 in hilly and tribal center, tribal areas, one family health, this one primary health center should be there. Then whatever this the primary health centers do, what they do, what are their functions? Again, medical care. As small hospitals at the periphery, they are working there. They have OPD services. OPD services means medical care. They are looking after the pregnant woman, and they are looking after the immunization and child health, and they are looking after family planning services, and they are apprising people. They are doing research and survey about sanitation and safe water supply, because people come with diarrheal diseases and some problems to them, and they are seeing the cause, and they are helping them in providing safe water supply and sanitation, and prevention and control of locally endemic disease. They are doing it. Then vital statistics collection and reporting, they are doing it. Then they are educating about health, and they are doing all the implementation of national health programs. So I have seen, I went to one of the primary health center at Delhi. Then I have seen how much they are doing for tuberculosis nowadays. Tuberculosis, they were talking of dots. Now it is more than dots. They make them to come to their center twice or thrice in a week, and they make them to have medicine there, and 3 days they give them. Then they call them again. They see whether they are taking the drugs. They prescribed medication. Then also, besides that, they see how better they are, how much better. That is, they are actually catering to the national health programs. Like that, some of the they see, as I say, whatever is endemic to that particular area, they are catering to those particular national health programs more. And they have referral health services. They are recognizing, they are identifying the people with particular problems, and they are referring them quite right time, so that there will be no complications, and there will be no case fatality. And then again, training of health guides. They are doing training of all health guides, health workers, local DAIs, health assistants, and small short-term, all this ASHAs, USHAs, they are training them there, as well as then they are they are working at sub-center level. Most of the times they are trained at this primary health center level. Then who is there at primary health center? Primary health center, we have medical officer, pharmacist, nurse, midwife, health worker, female, block extension officer, health assistant, male, female, and you have UDC, LDC, lab technicians, drivers, and others. Then you have, nowadays you have community health centers also, and rural hospitals are there. community health, the rural hospitals, they are established so that there will be some of the surgeries, some of the treatments are done there. There are rural hospitals, district hospitals, specialist hospitals, teaching hospitals. So these are the hospitals which are catering to the healthcare, this healthcare of the people. There is health insurance scheme also, which my first speaker talked to you about, health insurance schemes, and they are helping they are helping people uh, by having this private for profit schemes. That is, health insurance schemes are there. They are being catered at some of the private hospitals, and people are benefited there. Then there are some employed based schemes. They are insurance by NGOs, community based health insurance. Then voluntary health insurance schemes, private for profit schemes are there. Then there you might have heard about employee state insurance scheme is there. Then about there are central health government scheme, central employees के लिए, and this central health scheme, it was started in 754, and this central government employees, they get free outpatient this care, they get free medicine, they get some of the investigations free, and sometimes they get free home visits. We are visiting home family health, we are catering through government hospitals or this, but the central government health schemes, they are providing this domiciliary care for pregnant women, and also for chronic diseases, and they are giving free medicine, free lab investigations, and if required, they are giving free hospital facilities. Then they are giving specialist consultations free of cost. Then they are giving pediatric services, emergency treatment, and like that you have a private sector. You can most of the times we go to the private practitioner who is available to us within our vicinity. So that is private sector. Nowadays you can see each and every, so many private practitioners are there. Then voluntary health, this voluntary health agencies are there, that you might have seen this role of India, this Indian Red Cross and International Red Cross also in healthcare system, and family planning association. So many are there. Then health programs you can see. Now, if I will see, yeah, just I can थोड़ा सा zoom करो इसको. If I'll see this. First slide, please. मैं थोड़ा सा, I will just run with the slides within 5 minutes. Excuse me. First slide, please. Can I have first slide? Hello? Can I have first slide? Can I have first slide? No, after this. Next. No, it's not visible. Next. Okay. No, it's not visible to me. मेरे इसमें फोन पे भी नहीं आ रहा है. No, you can have my first, second, third slide onwards. So थोड़ा zoom करके. No. यही healthcare system, this one. So to conclude with my this PPT, if you'll see healthcare delivery system, it comprises of all the delivery models in practice. That is organized efforts of both the central and the state government. You should always remember, health is a state subject. It is not, but everything, funds are allocated by the central government, plans are made by the central government, and most of the things are provided by the state government, the central government. But it is a state subject. It is state's responsibility to make the citizens healthy. And when you'll see this, it's a 3-tier system of primary healthcare infrastructure in rural areas. Pata nahi kya hai. Next. See, when I have talked about this 3-tier system in primary healthcare in rural areas. Next. Then MCH. Hospitals at state and district levels. MCH. I have covered all this. If you have any question, you can ask. If you go through this presentation, you have all this. What is the responsibility of the central government? Then there are some of the functions in the union list, some of the functions in the concurrent list, some of the functions in the state list. Then there are district functions. Then there are village functions. Then these are the functions, and they have shown levels of organization is in this. But I think most of the things I have covered, so you can go through it. If you have any question, you can ask me. You go through it, and if you have any question, you can ask me. Okay.
Thank you, ma'am, for this informative presentation. I hope participants have learned a lot from this presentation. Ma'am, there are few queries.
Yes, ask.
I am forwarding.
Okay.
So the first question is, what health services are provided to general mass? If at all the government provides health services, only few people receive. Why it is not provided to the most needy people?
See, I said there is communication barrier. There is communication barrier. If people, and there are so many things. See, when we go to the hospital, I have worked for 37 years in tertiary care hospital. When we go to the hospital, we see long queues, and long queues, before 10 they come and stand in OPDs. And when somebody with political background or some rich people come, they don't have to stand, they just enter. It is our system. We have to do it. Otherwise, healthcare is available. The government is spending a lot, but government cannot be available every time. That is, we are making it not clean system. It is because of our way of doing it. Otherwise, you will see, if you see Jammu Medical College services and SKIMS services, Kashmir Medical College services, every service is there which is available in the this well-to-do Apollo hospitals and other big the developed hospitals. But what the thing is, it is not available to the poor. And only people with that is with Jaan Pehchan or something, they are getting every facility. They are getting big surgeries done, which will cost them lakhs. They are getting those surgeries done, and which our poor and middle class people, they are doing in the private sector. It is unfortunate. Because otherwise services are available. Most of the services are available in every state, even in the rural areas. If you'll go through, you will see how much money is spent in the rural areas. I will give you example of immunization. I have once heard immunization के लिए वो cold storage का आता है. Some people, they take those cold storage things also to home instead of keeping it at this primary health centers or district health or community health centers. They are, and also when we see the referral people, they die on the way. People are referred, they are referred in the emergency. They don't have to refer them like that. They have to do something for them, so that if they are transported for 1 hour, they will be safe. They are referred without doing even first aid. So that is unfortunate part of on us, because we are not responsible. Because when we are talking of our rights, see, if you'll go to the Gandhian theory, he has said about rights and responsibilities. Rights and responsibilities. I will say my right is healthcare, but the other, I am a nurse. I am responsible for providing healthcare. I am a nurse. I am responsible for providing healthcare to the people. If I am not doing it, so I will not be giving right to the people. So like that, when I am not giving right to the people, I also don't get right at some place. When I am going to secretariat, they don't allow me to get in, so they don't do to my work. That is rights and responsibilities. If all of us, we are sincere in doing our job, we will get our rights. If we will do our duties, we will get our rights. That is the thing. Why we are not getting it? Because we are not what we call, we are not doing our duties. We don't have work culture in government sector and private sector. May for one third of the salary.
So I will continue. So ma'am's connection has lost. So next we have came to end of our webinar, which was on healthcare delivery system in India, organized by Stephen College of Nursing. Next, I would like to invite Miss Shilpa ma'am, nursing tutor, Stephen College of Nursing, to deliver the vote of thanks.
Am I audible, ma'am?
Yes, ma'am. You're audible.
Thank you, ma'am. The best and beautiful things in the world cannot be seen or even touched. They must be felt by heart. Thank you is one such prayer among them. On behalf of organizing team, I, Shilpa Thakur, nursing tutor, Stephen's College of Nursing, consider it a great privilege to propose a vote of thanks to all dignitaries who have made this webinar a memorable and successful event. My heart is filled with a deep sense of gratitude and respect for our distinguished speaker, Dr. Mehmooda Regu, Principal and Professor, IUST, from the College of Nursing, not only sparing her invaluable time for us to grace this occasion, but also for enlightening us with commendable talk on this topic, healthcare delivery system in India. Thank you for clearing our concept and enhancing our knowledge pertaining to the topic. Ma'am, we are really obliged. I'm running short of words to express my humble thanks to Sir P. Vazhumuni, Assistant Professor at SCON. You have provided us with the valuable support in enriching this program. I would like to extend this vote of thanks to our esteemed Principal Ma'am, Mrs. Needhar, Masters in Nursing, Obstetrics and Gynecology. You have fostered a sense of support and appreciation that allow us as educators to improve our practice daily. We are forever grateful for your impact on this college. No event can take shape without a hard-working leader. It's the dedication and enthusiasm of our venerated administrator, Sir Noj Kotru. Thank you, sir, for your continuous support. I would like to give sincere thanks to Miss Nancy, anchor of this event, doing a commendable job. I want to thank Mr. Satwara, technical support, who have put a great effort to make this webinar possible. Last but not least, I would thank worthy SLA advisor, Ma'am Ms. Kavita Rana, for her guidance, faculty members, dear students, and all the attendees for being such a great part of this webinar. I wish you all a blessed day. Thank you. Over to you, ma'am.
Thank you, ma'am, for this wonderful vote of thanks. So once again, I would like to thank organizers, speakers, students, and audience for making this webinar a great success. It's been a pleasure being with all of you today. Thank you. Before going, there is one instruction. All participants can find link for feedback in chat box, and who all are attending it through YouTube can find it in description. After filling the feedback form, then only you will receive your online certificates. Time will be 6 p.m. today only to fill the feedback form. So kindly fill the form, all of you. Thank you. Have a nice day. You all can leave now.